by GAINSWave. Men of all ages can be embarrassed by performance issues in the bedroom. Joining us today is Dr. Merrill Matschke, who will show how non-drug, non-surgical therapy called GAINSWave is helping men of all ages to have more confidence and enjoy intimacy with their partners once again. How are you, sir? Good to see you.
I'm very good, Tom. Thank you for having me.
I tell you what, this is an ongoing issue for men different ages.
Absolutely. And it's actually becoming a bigger problem. So you take a look at about 30% of men in their 30s will have this problem, 40% in their 40s, 50% in the 50s, and on and on and on. But what we're seeing is more and more men are suffering from erectile dysfunction. Now, to tag into your earlier segment, men's health really is a lot of it can be focused on when you look at erectile function, because it's a window into his vascular system. So it's an opportunity, if someone has ED, to step in early and not just treat the problem, but also address his his health long term.
Absolutely. Tell us about what exactly is GAINSWave.
So GAINSWave is really a revolutionary new treatment. Shockwave therapy has been around for a long time. We as a urologist, which I am, have used it to treat kidney stones.
Board-certified urologist.
Correct.
Spent a number of years in Chicago, down here, bringing this new therapy here as well.
Correct. And GAINSWave is a great opportunity to treat ED. In my hands, in our practice, what's unique is I'm a board-certified urologist with a specialty in sexual medicine. And of the GAINSWave's providers, about 1% have those credentials. Because I spent my life, the last 15 years, being the man to operate in situations when other treatments wouldn't work. So I really understand what's happening. But GAINSWave, what it does is it is treating the underlying condition. Unlike our current traditional treatments, the oral therapies, Viagra, Cialis, and the like, they're treating the symptom. Whereas Shockwave, GAINSWave therapy, is actually treating the tissue within. So you're trying to heal the problem rather than just treat the symptom.
Sure. Instead of putting a Band-Aid on something, you're actually going to the problem and go directly to what is causing that and then take care of it. How does it? This is electromagnetic pulse of some sort.
Right. So it's actually a shockwave. Okay. And when you power down that shockwave, it's causing micro stress or shear stress at the tissue level. And what that actually does is it activates our body's healing mechanisms, whether it be tissue growth factors, vascular growth factors. Basically, when we cut ourselves or hurt ourselves, our body heals itself.
Sure.
So what GAINSWave is doing, and this has been proven, okay, it's not,
FDA approved, by the way.
It's an FDA cleared machine to improve blood flow.
Okay.
And so what happens is it activates our body's own healing mechanisms, vascular growth factors, angiogenic growth factors. Basically, our body's army to heal, and the tissues are what it is healing. It's not really increasing the size of a blood vessel, which we talk about, but the penis is not a blood vessel, it's a vascular sponge. And so the sponge, the tissue that makes up the sponge, is being healed by the actual shock waves from the GAINSWave treatment.
That's the big difference between the other performance-enhancing treatments that are out there, correct?
Right. So for the first time, we're treating the underlying condition. We are not treating the symptom. This should be and should be preventative medicine used first before the other treatments. And I predict within 5 to 10 years, this therapy will be first line.
We've got just a couple of seconds left. The treatment, how long does it last?
Well, so the treatment varies on the man's condition, okay? There's certainly studies that show that it can last up to 2 years or longer, but it really, and that's one of the things I like to talk to people about, because you need to explain how severe their condition is, because if they have a very severe condition, they may need repeat procedures.
Very good. Doctor, thank you so much for being here with us. We do appreciate it. We're back with more Low Country Live right after this.